about empathy and medicine being almost as equally as important, both of the factors. Someone that comes from a less affluent background, but has all of these other skills, but is not necessarily up to standard with their grades, then the other factors should definitely be able to balance out the grade factor, and that is something that should definitely be taken into consideration in terms of the application.
Is there a danger that you're at the risk, yeah, when you're trying to balance these different factors in these in a person's application, is there a risk to actual like competency? And because being a doctor and being in the medical industry, it's life or death. You want the brightest, the smartest, the most empathetic. You want the best and the best dealing with people in their most vulnerable stages. So, is there a risk while enhancing diversity of socioeconomic background that you sacrifice competency and actual skill?
So I don't think there's a risk. I don't think there's a risk because competency in terms of working within your limitations is something that we're taught in medical school. Medical school. So if you don't necessarily have the medical knowledge, again, that's completely fine because that's what you're taught in medical school. It's it's So in terms of like being danger for the patient, I don't think it would risk that. If anything, I think it would improve patient care and the patient outcome. You know, just the stuff that we talked about earlier.
Hmm. So, okay, that's interesting because I think from my perspective, I don't know if I would want to sacrifice in a way the standards. I believe that the standards that are there, like the
Hmm.
grades, the A level and the GCSE requirements, the work experience
Hmm.
requirements, and the interview, I think those are very, very fundamental parts that really get to know
Hmm.
you as a person. Wow, I completely agree that it should be a more holistic approach, and you should take some of these these experiences into account, like if you had a very troubled childhood or there's some like trouble in the home, these definitely should be taken into account. But any sacrifice to standards, I think, would be a dangerous precedent.
Hmm.
Or I think another alternative to that is, let's say we implement your plan,
Hmm.
and then while in medical school, if any little mishap, any academic or medical failure or something that's on such a grand scale happens, I think it should be immediate a one strike rule to some extent. I don't know if that's the case already, but I think there
Hmm.
needs to be the standards need to be upheld. I think that's what I want
Hmm.
to reiterate.
I mean, I do agree with that in a sense, and my point wasn't being that we should take anyone in. It is more based on competency and medical competency. More importantly, is something that you're taught in medical school, and is something that you can sort of like develop over time.
Okay.
Um, And once you do become a doctor, you're always under someone else's supervision. You're almost always under someone else's supervision. So you're as a junior doctor, you're usually working under a consultant.
Yeah.
So in terms of a grand mistake that could potentially kill a patient, that sort of mistake, like for that to happen, that there has to be a lot of like misjudgment